Let's discuss Li4, joining valley, one of the 5 command points. Li4 is located on the radial aspect of the hand between the first and second metacarpal bones, closer to the second metacarpal bone and approximately at its midpoint. How to find Li4? When pressing the thumb and index finger together, the adductor pollicis and the interosseous dorsalis muscles will form a bulge. Needle Li4 at the highest point of the bulge and push it further towards the inferior aspect of the second metacarpal bone. Or spread the thumb and forefinger and place the distal phalanx of the thumb of the other hand on the webbed border. When flexing the thumb, its tip will point to Li4, or insertion on the angle bisector between the first and second metacarpal bones, needling in the direction of the midpoint of the second metacarpal bone. Needling of Li4, 0.5 to 1 soon vertically or slightly obliquely towards the palmar aspect of the hand. Caution: reducing needle techniques are contraindicated during pregnancy. Exception: to induce labor. Actions or indications: releases exterior. This is actually the main point, to release the exterior. Regulates face and head, regulates defensive chi or wei chi and sweating. Opens the channel and luo connecting vessels, alleviates pain, promotes labor. Special features: Yuan-Source point, Gawu command point for the head and mouth, Madanyang heavenly star point, entry point according to some authors. Li4 is the most important analgesic point for the whole body. The most important single distal point for disorders of the face and sensory organs. It is the most commonly used point in clinical practice. The combined bilateral needling of Li4 and liver 3 between the second and third metatarsal bones is known as 4 gates. They strongly regulate chi and blood, stop pain, and relieve spasms. Li4 is one of the classic points of acupuncture. As a Yuan-Source point, its connection with the origin is harmonizing and regulating for body, mind, and spirit, relieving anxiety. The great self-regulating capacity of Yuan-Source points helps balance the large intestine, either when it has become bogged down in the mundanities of life, seeing only the cold face and never the diamonds, the endless practicalities of life, or when at other times, large intestine has become detached from the world, walled in by memories, resentments, or perhaps too deficient in energy to move on in life. When out of balance, large intestine can find it hard to connect with others, even when help is needed. The instinct to do it their way and be defensive can lead to tension, often exhibited along the pathway as well as in behavior. This can be eased by Li4's connection with the Yuan Qi, allowing Li to relax and move. It strengthens Qi and Wei or defensive Qi. Li4 is a powerful point. As the entry point, it invigorates and regulates Li meridian and Fu. When pain originates from the intestines or areas traversed by the Yangming channel, Li4 can act as a powerful antispasmodic muscle relaxant. Combination of Li4 with liver 3 is known as the 4 gates and is commonly used to treat pain, spasm, and tension of body, mind, and spirit. Li4's ability to move and tonify the blood can strengthen muscular tension along Li channel and strengthen atrophied muscles. The name Great Eliminator indicates function of the large intestine, not just at the physical level, but also at the level of mind and spirit, wherever the system has become blocked, constipated, and toxic. It can help restore imbalance, showing as over-refining, verbal diarrhea, or endless pedantry. Like lung 7, Li4 can prompt an emotional release, but it engenders calm, equanimity, and regularity of the automated rhythmic processes of life that, under the aegis of the Po, keep us in harmony with life. Li4 is sometimes called the command point of the face and mouth. This meridian directly affects the face and sense organs. Li4 is often used as a distal point for mouth, nose, and eye problems on the face pertaining to the Yang-Ming channel, often combined with Li20. Li4 is a major point to release to exterior, clearing heat, wind heat, and fevers. It strengthens dispersing action of the lungs to release exterior and expel wind, and is often combined with lung 7 to clear external wind. Li4 is one of the 9 needles for returning yang, so is used as a revival point after a yang collapse. It harmonizes ascending of yang and descending of yin, recalling the power of metal to balance, and can be used to balance ascending rebellious qi of the stomach, lung, or liver, or to raise sinking qi. Li4 was included by Ma Danyang, the great physician of the Jin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for headache, swelling of the face, malaria with chills and fever, tooth decay, nosebleed, and lockjaw with inability to speak. The Ming Dynasty author Cao Wu, in his work Glorious Anthology of Acupuncture and Moxibustion, also recognized the supreme importance of Li4 and included it among his 4 command points for the face and mouth. Some hundreds of years later, it is still probably the best known and most commonly used of the acupuncture points. Li4 is a primary point to expel wind cold or wind heat and to release exterior. It may be useful in this respect to view the yang Li channel as the exterior reflection of the yin lung channel with which it is coupled. The lung dominates exterior by virtue of its function of controlling skin and body hair and spreading the defensive qi. Attacked by exterior pathogenic wind cold or wind heat, which disrupts the exterior portion of the lung system, therefore, may be treated via the points of the Li channel, most notably by Li4. Thus, the Great Compendium of Acupuncture and Moxibustion recommends this point for injury by cold, headache, rigid spine, and absence of sweating. This is the classic presentation of wind cold binding the exterior portion of the body. The basic principle in Chinese medicine for the treatment of this condition is to release exterior by inducing sweating, thereby expelling the pathogen along with the sweat and facilitating circulation of defensive qi. In fact, Li4 may also be used for injury by any exterior pathogenic factor which is accompanied by sweating, in this case, pathological sweating, which does not serve to expel pathogenic factor. This dual action of Li4 on both inducing and stopping sweating is reflected by the advice given in the Great Compendium of Acupuncture and Moxibustion to reinforce Li4 and reduce kidney 7 if there is no sweating, and to reduce Li4 and reinforce kidney 7 in cases with copious sweating. The explanation of this apparently contradictory function is that Li4 is able to regulate defensive qi and hence adjust the pores, whatever the pattern. Indeed, some authorities go so far as to attribute to Li4 the ability to tonify the defensive qi.